Hello, I'm Michelle Gurvitz. I'm an adult congenital cardiologist at Brigham and Women's Hospital and Boston Children's Hospital. And I'm here to talk to you as chair of the new 2025 guidelines for the management of adults with congenital heart disease.
Hi, I'm Stephanie Fuller. I'm the Chief of Congenital Heart Surgery and the co-director of the Blaylock Taussig Thomas Pediatric and Congenital Heart Center at Johns Hopkins. I'm a cardiac surgeon who served as a vice chair on the writing committee.
I'm Eric Krieger. I'm an adult congenital cardiologist and section head of the ACHD group here in Seattle, Washington at the University of Washington and Seattle Children's Hospital. And I am also a vice chair on the 2025 ACHD guidelines.
We are here to talk to you today about the 2025 new guidelines for the management of adults with congenital heart disease. This document is building on the original set of guidelines that was produced in 2018 for management of adults with congenital heart disease. There is an update to the guidelines now because this continues to be a growing population of patients. The number of adults with congenital heart disease now outnumbers children with congenital heart disease in the United States, and this is a group that has increasing complexity as those with severe heart disease are now surviving to adulthood. Even with this growing population, there are only a small proportion of patients that are seen by adult congenital heart disease specialists. And there aren't enough specialists to cover the over 1 million patients with adult congenital heart disease in the United States. So it's important to collaborate with other cardiologists, including adult cardiologists and pediatric cardiologists and primary care practitioners and other colleagues like obstetricians to help make sure that our congenital heart disease patients can get the optimal care for their hearts and for their other medical issues. In doing so, these guidelines are set out to be able to help the adult congenital cardiologists stay as up to date as possible in managing these congenital heart disease patients, but also to help our colleagues in general adult and pediatric cardiology to collaborate with our adult congenital heart disease specialists to be sure that patients in all areas of the country and in all communities would be able to be connected to adult congenital heart disease care. In doing so, these guidelines include classifications called anatomic and physiologic classifications that can help determine the severity of the condition of each patient and help different physicians and other care providers determine where and when these patients should receive care and where and when procedures should be done, both cardiac and non-cardiac, and what supports would be needed to help care for them.
So the purpose of the 2025 guidelines was really to build on the 2018 guidelines, but to bring the latest recommendations over the last several years and evidence and both expert opinion, which is supportive care information and to all physicians caring for these patients and all care providers. It is presented in a succinct and easy to read manner. We hope to ensure that all ACHD patients have the ability to receive guideline-directed therapy, and this includes over 50 new and revised recommendations in comparison to the 2018 guidelines. Some of these new sections include recommendations based on mitral valve disease, Schoen's complex, and vascular rings appearing for the first time in our ACHD guidelines.
So there's been a lot of great science that's taken place since the 2018 guidelines, and those have influenced the updated recommendations in the 2025 guidelines, and you'll find that reflected throughout the entire paper. A few areas that have undergone major changes are our treatment of patients with shunts and pulmonary arterial hypertension. We have more specific recommendations about the use of pulmonary vasodilators and more updated recommendations about which patients with pulmonary arterial hypertension and shunts can undergo shunt closure as long as they're undergoing expert care by PAH specialists. There's also been major changes in our understanding of arrhythmias in congenital heart disease, particularly the mechanistic basis of arrhythmia, ventricular arrhythmia, and tetralogy of Fallot. We have updated recommendations that describe the use of ablation therapy and risk stratification prior to pulmonary valve replacement in these populations. There's also emerging science about the use of heart failure therapy in different specific ACHD populations, and to reflect that, our recommendations for the use of GDMT in patients with ACHD and heart failure have been updated. There's going to be ongoing research in this area that in the future will allow for more specific prescriptions of specific medications for different anatomic subcategories of adult congenital heart disease. But I think it'll be important to see all these updates in the 2025 guidelines.
Putting together these guidelines was a tremendous effort by a lot of people over greater than 1 year. I would really like to thank my vice chairs, Dr. Krieger and Dr. Fuller, and I would very much like to thank our entire writing group who put in a lot of effort in getting all of these sections done. We'd like to thank the peer review committee for their insightful comments, which really helped focus and improve this guidelines document. We'd like to thank the Joint Committee on Clinical Practice Guidelines for their support in our efforts. And we'd very much like to thank Rachel Schunder, our administrative staff, who without her help, this guideline could not have come to fruition. And if you want to learn more about adults with congenital heart disease and how to care for them, we encourage you to read the paper. Thank you.